Frequency Podcast Network. Stories that matter, podcasts that resonate.
It was the era of home workouts, baking whatever recipe you had saved on your phone that you've been meaning to try, and of course, all the online shopping, including the groceries, the snacks, the takeout meals, the drinks, just about anything, really, that could be taken from a store and brought to your home. The COVID-19 pandemic changed the way we did our everyday, especially the way we viewed and interacted with food and our bodies. A recent McMaster University study published in the Canadian Medical Association Journal showed that obesity rates increased at a faster rate during the pandemic than they did pre-COVID-19. By measuring the findings using the Body Mass Index Scale, or BMI, they found that restrictions made it harder for Canadians to access healthcare tools, changing the way we view social determinants of health. But what else was behind the pandemic era? And is the BMI scale even a legitimate tool to measure our bodies and health in this day and age? I'm Maria Castaigne, and today on The Big Story, I'm talking to Abby Sharp, registered dietitian and host of the Bite Back podcast, to break down the latest report and help us understand what really happened to our bodies during the COVID-19 pandemic. Abby, thank you so much for talking with me today.
Thank you so much for having me.
So, a recent study published in the Canadian Medical Association Journal found that obesity rates increased faster during the first 3 years of the COVID-19 pandemic compared to its rate of increase over the previous 11 years before April of 2020. There's so much to unpack here. It was a very long study, so let's dive in right from the beginning. Tell us about the study itself and how exactly it came to its findings.
Yeah, so this was a pretty massive repeated cross-sectional analysis of over 700,000 Canadian adults, basically using the Canadian Community Health Surveys spanning from 2009 all the way till 2023. So, we got into that pandemic pocket there. And researchers compared the pre-pandemic period, so about January 2009 to March 2020, to the pandemic era, which was April 2020 to December 2023. And they were looking at changes in BMI-defined obesity using regression models. So basically what they found was there was an annual increase in obesity that nearly doubled during the pandemic. So essentially, it jumped by an extra 0.44 percentage points per year, and that was compared to the previous 11-year trend. And they found that the kind of class 2 and class 3 obesity increased at a greater absolute rate than the class 1, which essentially indicated that there was a shift towards more severe states of obesity. And the relative increase in that class 3 obesity was the greatest among young adults and women.
Right. So, as you said, one of those highlighted conclusions shows that the group who experienced the biggest increase in obesity rates at 9% over those pandemic years was young women aged 18 to 29, which is, thinking about it, such a vulnerable group. That's in a woman's life. That's probably one of the most vulnerable times for her body. And that's higher than the rate of obesity in men in that age group at 6%. What do you make of that discrepancy?
Yeah, I think it's a great question. And I also think there's a lot potentially going on here. I think, first of all, statistically, we know that women are just more likely to be engrossed in diet culture. They may have spent their entire lives restricting or trying to shrink their body to be a smaller size than just like what is genetically comfortable for them. And that's not to say that men are not affected by diet culture. They absolutely are. And they also absolutely go on weight loss diets. But socially, women are disadvantaged by quote unquote fatness, a lot more than men. So there's just greater pressure for us as women to make greater strides to be smaller. And what we know about dieting and severe restriction is that it's always a setup for a binge. So for women who've been stuck in the cycle of discomfort, just like hanging on to a routine that's keeping them smaller and more hungry than they otherwise would be if they were fueling their bodies adequately, when all of their supports are ripped away and all these extra stressors are added, as we saw during the pandemic, they very likely just could not keep up the immense effort to stay or get smaller. So we know that COVID obviously brought in a ton of stress, social isolation, lots more caregiving, changes in routines, all of that. And then, of course, we lost access to a lot of our weight management supports like the gym or fitness communities and things like that. And then I would say also that folks who are already dealing with food insecurity also lost a lot of access to their supports. And food insecurity is also a huge risk factor for obesity. And so when we think about what we were doing during the pandemic, especially for us women, we were baking sourdough bread and cakes and watching TikTok for hours a day on the couch. And I think the other piece that we have to really consider, especially when it comes to women, is that, and this was not really differentiated in this study, is the kind of underlying mental state of folks whose weight did increase. Because yes, we saw the obesity rates rise, but we also saw eating disorder rates rise. And actually, this was one of the most concerning and kind of well documented mental health trends to emerge during that period of time. So just to give you some examples, there was a 121% increase in eating disorder related hospitalizations among youth in Ontario, during that first year of the pandemic. And then NEDIC, which is the National Eating Disorder Information Center, reported a doubling of calls and messages to their helpline. And then obviously there were more barriers and delays to getting the help and care that we needed. And it was not just obviously anorexia, which is I think what a lot of people think of when they think of an eating disorder, which feels at odds with this trend towards increased obesity. But of course, emotional eating, binge eating disorders, also hugely on the rise. And also, if you recall those early days of the pandemic, there was like a real hoarding mentality going on for everyone. But for somebody who was already susceptible to an eating disorder, that could absolutely trigger an episode to overeat. So I think that there's a lot of different things going on, but I would think those are some of the big ones.
Yeah, TikTok and sourdough, those are like two main parts of the pandemic, honestly. And I
Yeah.
think with that, we also can't talk about the pandemic without talking about this mass influx of YouTube workouts and at-home plans and DIY gym equipment. It was almost like people didn't miss a beat when it came to keeping a workout routine or even implementing one because they had all this time and it was kind of like a trend to do all these things. And that kind of came with this like weird unhealthy obsession with like workout challenges, and I cannot not mention the Chloe Ting ab workout. She was like an icon of the pandemic workout era. And girls were just obsessed with it. Take me back to that era a little bit during the pandemic. What was that like for, a woman aged 18 to 29 taking this all in?
Yeah, well, like you said, we had an awful lot more time on our hands and we were kind of, stuck at home. We couldn't kind of engage in our usual routines, whether that was just kind of like walking to work or, going to a fitness class or going for a bike ride. Even there were times, at least, here in Ontario, where we were kind of discouraged from even like going outside. And so I think, especially for a lot of women who felt they had gained weight in those kind of first few months of COVID lockdown, there was this drive like, oh, we're gonna go from like 0 to 100 kind of thing. And of course, on the one hand, I think it's great that people got creative with what they have available to them. They stayed active, very important for mental health, of course. But then, as I kind of mentioned earlier, the pandemic really created this perfect storm for disordered eating tendencies or risk factors to become full blown EDs. And we spent so much of our time as young women watching TikToks of beautiful influencers doing their body checks and sharing their what in a days and their fitness challenges. And especially, I'm in Ontario, and a lot of the pandemic, it was cold in certain months, and it was hard to do things. And we're watching these women in LA who have access to fitness outside, and also areas of the world who don't have lockdowns, who basically kind of made it their full time job to be thin and fit and attractive. So there was a lot of nonstop comparison happening, despite circumstances being very different. And I think just coupled with the mental health impacts of the pandemic, it absolutely contributed to the rise in eating disorders as well.
When the pandemic started, it was 2020, and I was 20. I was about 20 during that time. And full disclosure, I was suffering from my own eating disorder at that time, and I remember seeking treatment for it before the pandemic started. But if anyone has an eating disorder or suffered from disordered eating, it's hard to come to reality or come to terms, or if it's not anorexia, it's a hard to admit to yourself that it's an eating disorder. B, even harder for others to admit to you that it is an eating disorder. So when I was receiving that treatment before the pandemic, I don't think I was taking it as serious as I should have. But once lockdown went into effect, I was kind of forced to either fix it or enable myself further. Um, and that's kind of what prompted me to do this story and talk to you, honestly, because when you look at this study, okay, obesity rates were much faster during the COVID-19 pandemic, sure, but what, like, that's such a small facet of the picture for these women who were most affected by the study. You know what I mean? And I'm sure my weight issues and dealing with that was my experience, but I'm sure it was an experience for thousands of other Canadians as well.
Absolutely, absolutely. There it really put such an emotional and mental strain on so many people. Living through lockdown meant, closure of gyms, fitness studios, sports facilities. We were shifting to working online, having to juggle childcare if while we're trying to get work done, or perhaps our job essentially dissolved and we were worried about the stress of what am I going to do? How am I going to pay the bills? Disruptions to food access during that financial hardship and food security issues, the mental health, just the emotional eating, the hoarding mentality, just this greater preoccupation with food. I mean, I remember when kind of lockdown first started, I felt very triggered, very anxious, just knowing that I had to plan every meal, every snack exceptionally well because I got to feed a whole family for a week with my one grocery order per week. So I was always thinking, "Oh my gosh, what if we ran out of food? What if I don't have this and I want this?" Like, there were things that I had to think about for the first time that I had never really thought about because if I needed something, I would just go to grab it at the store or run down to to get an Instacart or whatever it was. So I definitely found that mental load of planning meals kind of quote unquote perfectly and holding that responsibility as the woman, as the nutritional gatekeeper for the family was honestly, it was crippling. That alone, and I think that also fueled that preoccupation with food.
Yeah, yeah, it was definitely there was so many triggers, and again, not to mention that men didn't experience those same experiences, because of course men have their own struggles that they experience. But I think just the reality of it is that women experience those that mental overload of A, being the default parent in many households, and B, dealing with that and their own issues, their personal issues as women. So it's very it's a hard intersection. One of the authors in the study actually acknowledged the limitations of measuring obesity with the BMI scale, saying it doesn't take into account, bone density or body fat and other factors at play. For those who maybe don't understand BMI and its historical complications, can you explain why that's maybe not the best tool to measure our bodies with?
Yeah, absolutely. So first of all, BMI is really just a calculation based on two simple measurements, your weight and your height. It does not distinguish between fat, body fat and muscle, or bone density, water weight, fat distribution, which is incredibly important. So, just as an example, a bodybuilder that has tons of lean muscle could be classified as kind of quote unquote obese by the BMI standards, while a sedentary person with very low muscle mass and high visceral fat, the belly fat that we know is associated with chronic disease, they might be classified as kind of quote unquote normal or healthy, even though the latter obviously has a much higher heart disease risk, chronic disease risk. So that visceral fat, for example, is incredibly important. We can't differentiate where the fat is is landing, where it's that actual visceral fat as opposed to just subcutaneous fat on the rest of your body that is the one that's associated with heart disease. And there are other kind of measures that can be worked in, like waist circumference or waist hip ratio, which can add a little bit of a better predictor of health risks than just BMI on itself. But the other thing is that, BMI was never really originally, it was never intended to be used to determine somebody's health status as it has now. It was really just developed by an insurance company to just, stratify people into categories essentially. And so it does not do a really great job just determining health outcomes in certain populations. It doesn't account for age, sex, ethnicity, ethnic differences. So, for example, South Asian descent folks often have higher metabolic risk at lower BMIs, whereas someone of kind of more African descent may have more muscle mass at higher BMI. So, again, the BMI scale is applying the same cutoffs for everyone, but it's ignoring a lot of really important differences. And the BMI cutoffs, were just kind of set arbitrarily. It wasn't really set based on clear health thresholds when it kind of came into the play. And we know that health is so multidimensional. BMI tells one super duper one dimensional story. It doesn't reflect lifestyle factors like physical activity or sleep or stress or diet quality, mental health, even just like what your blood markers, your metabolic markers are suggesting. So it certainly is we use it because again, it's just what you know researchers have been using for a very long time, but it does definitely wildly misclassify health status for a lot of people.
How do you think doctors or medical professionals should talk about weight or obesity without depending on the BMI scale? Like, how can we change that conversation to reflect more modern language?
Yeah. Well, I think the first thing is to, focus on overall metabolic health, right? First of all, we know that it is absolutely possible to be, fat and fit. And it's also very possible to be thin and unfit. And so focusing more on the metabolic health rather than the number on the scale or what the BMI tells us. So things like blood sugar, blood pressure, cholesterol, and then of course weight circumference or body composition. So I think using terms like, fat distribution, functional fitness, health behaviors, body composition, rather than just weight and BMI is a much better kind of measure of health. Not to mention, I think we want to treat weight in the context of the social determinants of health and not just, a moral failing as we typically do. We just say, oh, somebody gets told, oh, you're in the obese 2 category, lose weight. We really need to look at the bigger picture of, why this is happening so that we can better support people to make changes to improve their health long term.
I like that you mentioned that the fat and fit and thin and not fit, because I personally am a believer of the Hayes movement, health at every
Hmm.
size. And I think, talking about that and it's so hard because skinny is now back in. Like being skinny is now cool. I think back in like 2016 to like 2019, I think being like a bit more thicker and curvier and like accepting more body fat was cool. Now we're back into like, anorexia chic and
Yep,
that kind of stuff. And you're seeing it all over TikTok and stuff. So I mean, I think a lot of this uphill battle is just language, especially amongst women.
totally.
That's the reality of it. So yeah. Um, you mentioned social determinants of health that was also brought up in this study. It found the pandemic and the public health restrictions it came with did some damage when it came to obesity prevalence. And the study itself called on the Canadian government to kind of rethink its policies surrounding healthcare so that it becomes more accessible and affordable and socially and culturally appropriate. And that could for example, include people having better access to health education or more healthier foods. If you were advising the Canadian government, what would you suggest and why?
Yeah, I mean, it's a very big responsibility, but I would say, first of all, we want to do things like strengthen food security. So that means perhaps subsidizing fresh produce, reducing costs in food deserts, supporting community programs with fresh, nutritious foods. That's very important. I would say also keeping physical infrastructure accessible and safe. So ensuring that, gyms, parks, recreational centers, safe outdoor spaces, they remain open and affordable even during public health emergencies. I think that was one of the big criticisms. And again, we didn't know what we didn't know, but that was for, especially for a lot of us families who had children in small places. I mean, not being able to even go to a park, I felt was dealt a huge blow to a lot of our mental health and physical health. And speaking of, mental health, I would say funding mental health and stress support systems. So we know that our mental health is closely tied to our physical health and our weight and in terms of our, ability to maintain a healthy weight. So making sure that those mental health and stress supports are accessible and available to people. I would also, like we just talked about, encourage healthcare professionals to move beyond just BMI or body weight. So using, greater focus on metabolic panels, behavior focused assessments rather than just the number on the scale. And then I would say, obviously I'm a dietitian and this is, very important to me. But, make dietitians more accessible, right? Nutrition, we know, is such a foundation to good health. And yet access to credible, individualized nutrition support is still hugely limited by, cost barriers and availability. So, we want to take the pressure off the system. We want to reduce chronic disease long term. So we really do need to kind of broaden our insurance coverage for healthcare professionals like dietitians, more government-funded public health roles, greater equity in access across different income levels and geographies. So important because there are so many dietitians who, there's actually a bottleneck in order to become a dietitian, and we know we need more of them. But unfortunately, it's just not always well covered by a lot of insurance companies. And the wait times to see a dietitian in, let's say, a hospital are incredibly long, and you basically are already sick if you get to that place. So, and then the last thing I would say is to, and this is very important to me as a social media dietitian, is to regulate wellness messaging online. We see so many kind of harmful, quote unquote, quick fix challenges. Now, like you mentioned, skinny is back thanks to this kind of trend of quote unquote skinny talk, kind of making all these big splashes across social media. And it's incredibly dangerous when a lot of folks are getting their nutrition education and information from social media influencers whose, essentially their body is their business card. They don't have qualifications in nutrition. They don't have training. They're not dietitians. And so, unfortunately, the data shows us, and this is where a lot of young people are getting their food and nutrition knowledge and education is from influencers online who are not educated to be able to, to be doing that education. And so I think some better regulation on that front is incredibly important. It would go a really long way.
Great conversation, great insight. Abby Sharp, registered dietitian and host of the Bite Back podcast. Thank you so much for talking with me today.
Thank you so much.
That was The Big Story. You can send us feedback on this episode or any other episode by emailing us at hello@thebigstorypodcast.ca or leave a voicemail at 416-935-5935. You can find us on the Seeker app or on all your favorite podcast players. Please rate, review, follow, and share. I'm Maria Castaigne. Thanks for listening.